Hi, my name is Tricia Sanford. I am publishing this video for the Liberty University Capstone in Psychology class, Psychology 491 with Dr. Anna Stevens. Mary Caccetti is a licensed clinical social worker with a master's in social work. She has 51 years experience in social work, social services, protective services, and counseling. During a client's first visit, she goes over her credentials and walks them through her confidentiality policy, which is what is said here stays here in this room. Unless there's a threat of harm to oneself or others, then it is mandatory that she reports what has been said to the authorities. To Mary, her most important job duty is allowing clients to present the trauma or issues they have been unable to process on their own. Then, over time, she walks them through it and assists them in processing. She builds a deep connection by caring and being empathetic and by truly listening to what the client is saying. When necessary, she asks questions to assist the client in continuing to share. She uses an eclectic mixture of therapeutic approaches and is flexible to move from one approach to another if the current approach is not effective or is not to the client's liking. She is willing and able to assist the client in turning to their faith and using that to heal and lean on, even though she may not share that faith. When guiding the client in sharing, Mary specifically listens and until she may speak on the issue in a manner that will often guide the client to finding their own answer or path, rather than giving advice. At times, she reminds the client of how resilient and capable they have become, perhaps even bringing up past issues that they have worked through together successfully, and the client is now seeing it through on their own. She is committed to establishing rapport and providing a non judgmental, safe place for all clients to work through their issues. Another part of her position is to diagnose the client. In the past, insurance companies would allow several visits for this, so Mary would use the rule out method. She would ask questions of and confer with the client to rule out different things like depression, PTSD, anxiety, grief, etc., until a diagnosis of one or more was unable to be ruled out. However, insurance companies now require a diagnosis be made on the very first visit. The most rewarding parts of her chosen profession are the internal rewards of seeing broken people begin to grow, heal, and progress into feeling better and stronger and able to face the issues with which they have been dealing. What Mary has found to be the most challenging parts of her occupation are not what one might think, which is helping others by going to court to testify for abused clients or going into prison diagnosis to diagnose and work with prisoners. It is to deal with the insurance companies. Getting correct information from these companies has proven to be very difficult, time consuming, and frustrating. Being paid in a timely manner has also proven to be quite challenging. When dealing with patients and their demanding mental issues, court needs, or traumas, she knows she has the power to act and to help. In the insurance arena, she feels powerless. Since moving her practice to Hawaii, there have been some specific areas besides insurance that have made her feel powerless. In her experience, the island where she practices is not a place that responds well to mandatory reporting. Perhaps it is because of the cultural differences she has run into here. After practicing on the mainland, or in Colorado, as you mainlanders would call it, for so long. What is acceptable as discipline for a child in many of the cultures represented here has not been acceptable anywhere else Mary has been a counselor. Therefore, she no longer works with child abuse situations. Each year, Mary adds 45 credits of continuing education to her schedule. This year, one of the classes she has taken was in gender dysphoria and other gender issues affecting youth today. On top of the continuing education classes, she is constantly reading, studying, and learning on her own. In the past, she has worked in clinics where growth was instigated in team meetings or one on one meetings with other therapists. Lastly, anyone who thinks they would like to pursue a career in counseling needs to have a passion for the work. It is not about money. It will not make you rich financially, but it will enrich your heart. While speaking with Mary, it became evident to me that social work and counseling is not just a job, it is a deep commitment to others. For one to take on clients, their mental health and emotional health, it is wise to recognize that it is a heavy responsibility and one that a therapist is not to take lightly. It is also something a therapist should not absorb personally, but sometimes they do because of the caring and safe environment that they must provide, and because the client and therapist do evolve into a deeper relationship as they work together. A therapist must mentally and emotionally keep a separation. And while they do their best to assist the client in walking through and working through any traumas or other issues that they are unable to deal with on their own, a counselor will be caring, empathetic, work to build a strong trust and relationship with each client so that they are able to guide and assist in the client's growth, healing, and moving forward. Another part of being a therapist is to know that one can't help every client. If a patient did not grow or does not heal while in counseling with a particular therapist, then it is for the therapist to know that they did everything in their power that they could possibly do. Thank you.